Welcome to DC to Be Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Lehman. He is an associate professor of clinical sciences at the University of Bridgeport and the College of Chiropractic. He's also director of health sciences, postgraduate education. The acronym is HSPED. As director of HSPED, Dr. Lehman developed the 3-year full-time resident training program in chiropractic, orthopedics, and neuromuscular medicine. So there's tons that we can learn from him. Dr. Lehman, thanks so much for being here. My pleasure, Noah. All right. So I wanted to kind of hone this discussion around the integrative pain program that you set up at the Connecticut-based federally qualified health center. Can you talk a little bit about the origin of that and where you're at in the process right now? Absolutely. Back in 2011, the Community Health Center, Inc. out of Middletown, Connecticut contacted the Chiropractic State Association and expressed interest in integrating chiropractic services into their primary care facilities. So the president of the association contacted the dean of the Chiropractic College at the University of Bridgeport, who then contacted me and asked if I would be interested in working with this particular program. And since I had some experience in New Mexico integrating chiropractic services into Loveless Healthcare System and also Loveless Medical Center and then the University of New Mexico School of Medicine, I felt very comfortable with the opportunity and accepted the offer. So what happened was we met with them. It was a great meeting. Dr. Brady met with me and the entire administrative staff for Community Health Center, Inc. at their facilities. And they expressed really a very positive interest in integrating chiropractic services to evaluate and manage patients that have chronic pain. So we were very pleased and excited with the opportunity. And what we decided, the Community Health Center, Inc. and the University of Bridgeport, is that we should actually do a pilot project. So we did a pilot project from January of 2012 until the end of June of 2012. And the concept was to find out whether the patients were happy with the chiropractic services and also whether the primary care providers were pleased with our participation. It was my understanding that many of the primary care providers were hesitant to actually work with chiropractors. Most of them didn't know what a chiropractor really did. And so they expressed some concerns initially about it. So that was another reason why the pilot project was of value. And one thing that I think future chiropractors should realize is that no matter the value of your service, if there's not some form of reimbursement that provides for a profitable situation for the organization you work with, I think if you had the cure for cancer and it wasn't properly reimbursed, they wouldn't be interested. So we had to make sure that the financial model was also workable. And with a federally qualified health center, it's a little bit different than private practice. Not a little bit, it's a lot different. And they have many more hoops to jump through to qualify as a federally qualified health center with the government, plus they have to be credentialed by NCQA. Most of them become patient-centered medical homes, so they have to be credentialed by that particular group. And then they have to be credentialed by the Joint Commission. So because of all the different requirements that they have to fulfill as a federally qualified health center, enhanced reimbursement program. They also have specialized grant monies from the government. So when a chiropractor thinks about our Medicaid, they believe, one, the reimbursement is either not available or it's so low that they can't make a profit. And that's whether you're an MD or a DC, it's problematic. But the healthcare reform situation is such that they actually want that to happen. They want it to be difficult for people to be in private practice because private practice has some faults, including
reproduction of service, duplication of services, increased costs because the care isn't coordinated, things like that. It goes on and on and on. But so the concept with the integrated or the changes that are recommended through the Affordable Care Act is to provide coordinated care. So these federally qualified health centers, number one, are properly credentialed. They receive a much higher reimbursement, whether the service is done by a chiropractor or an MD. So they can justify bringing in chiropractic services because they are reimbursed properly. So if the pilot study showed that the patients were satisfied and the providers were satisfied, they then were going to contact the federal government and ask that chiropractic scope of practice and reimbursement would be expanded, in other words, included into their program. And after 3 months of the 6-month pilot project, they were happy. They petitioned the government, and they, within 2 weeks, had it approved. So we knew ahead of time that at the end of the 6-month pilot project, we were going to be talking about a long-term arrangement. So it was very, very good as far as the pilot project. And the way it worked, by the way, is I volunteered for 6 months without any reimbursement, including my expenses, to work with teams of students. We had 3 students at a time and myself with these patients. So we all worked together as a team. It was really a very interesting opportunity. So I more or less supervised the evaluation and management, and the students did all of the services that they could. If they ran into a problem, then I stepped in. Mm-hmm. So that's how the pilot project worked. Students were an essential part of the project. And so we had, during that time period, we actually had 4 different teams of 3 students on each team. It was a great project. Students loved it. And I know it was a good experience for some of them who have since graduation figured out ways to get employed in federally qualified health centers. I don't think it would have happened had they not had that experience. But so at the end of the 6 months, we then went into a long-term arrangement. But we started off with just 10 hours a week at one facility, and currently we're at 12 different facilities in Connecticut. And this summer we're starting at 7 new facilities, 7 different sites in New Jersey. And our intention is to expand nationwide with federally qualified health centers. And now it takes me, you've got the platform. I think I answered that question, right?
You did completely. And so, yeah, I mean, is there an opportunity? I mean, is this something that every school can do? Was that opportunity very exclusive to that federally qualified health center being, hearing about your reputation at University of Bridgeport and being interested? Or what do you see as the kind of obstacles to this expanding nationally? Because I know for myself as a student, that type of fellowship is invaluable.
Well, let me take you to the next step, if I could, before I answer that question.
Please do. Yeah.
Okay. So after 2 years, we decided to start a resident training program. And it had been in discussion, but after 2 years, we actually started it. So it's a 3-year full-time resident training program in neuromusculoskeletal medicine. And upon completion of the training, then the doctor, it's no longer a student, right? They've graduated, they have to be licensed. But by the end of the 3rd year, we'd like them to take their examination with the Academy of Chiropractic Orthopedics. So there's a written part, online written multiple choice, and then there's a practical exam in Minnesota. So once they become board certified, then what we want them to do is stay with us if they would like to. And we offer a fellowship at this point in time. We then relocate them into different federally qualified health centers, and they become part of our faculty. Now, why would a student want to be a resident? Think about it. Everybody's going to go out and open a practice and make $1 million the first year, right?
We all hope so.
Yeah, exactly. Well, here are some of the advantages. There's a flat salary for the first year, an increase for the 2nd year, an increase for the 3rd year. And I'll tell you, what we pay is $46,000, $48,000, and $50,000. We pay all benefits, pay liability insurance, etc. But they are full-time faculty member of the university. And then after they complete their board certification, there's a significant increase in salary, and it increases based upon how much time they're with the university. But we take the doctor into a fairly significant six-figure salary. Now, that's okay, right? That's okay. You're board certified, you got a job, you got full benefits, etc. But here's the other part. We want them to stay with us at least 10 years or go with another nonprofit organization for a total of 10 years, because then all the student loans are forgiven.
Yeah, public service loan forgiveness. That's the best option for chiropractors out there, and very few people are able to utilize that.
Exactly. In fact, this is the first year that anyone's actually had their loans written off. It started with President Bush in 2007. And so people had to go 10 years, right? So this is the 10th year for some of those initial participants. So anyway, we don't have anybody at that point yet, but we will have. And so some of the doctors have actually told me there's more value in writing off the student loans than the salary. Because if you have a $300,000 student loan debt and you go full term, it's a lot of money.
Yeah, it's a lot of money. And once you go full term, you still have to pay taxes on the, $600,000 you haven't paid off because of the accumulating interest over time. So it's not like when they forgive it, you get off scot-free. You're still paying taxes as if you made $600,000 in a year.
And it's more complex than that, because if you owe $300,000 full term, you're going to owe $900,000. If you're in private practice with a 50% margin, you're going to have to make $1.8 million to pay that off. If at the end you don't pay it off, let's say you still owe this $600,000 of interest, when they write that off, then the IRS advises you that 33% of that money is owed to them in taxes, and it's not ever forgiven except with death or disappearance. So anyway, we hope that our doctors won't have to have failure at the end, but complete write-off. With the 2007 student loan forgiveness program, there's no tax consequence. So what many of our residents are doing is they're paying the minimum. And one told me that at the end of 10 years, he'll only be paying $6,000. And everything's written off. So in our opinion, it's really a win-win-win for the students.
Yeah, and a win-win for the profession too, because at least what I'm hearing from you is that you're really training this generation of chiropractors that's able to integrate chiropractic services into a multidisciplinary clinic, which not very many chiropractors are good at that. So could you talk a little bit how chiropractors can, what our unique niche is, or what our role is in terms of offering chiropractic services, and how you've seen that play out and how that's really assisted the physicians to do their jobs?
Right, I'd be happy to. Some chiropractors believe that this is too narrow. But what we provide is evaluation management. We do a differential diagnosis, and then we do hands-on treatment, which includes manipulation or adjustment, soft tissue treatment, exercise recommendations, postural recommendations, diet, etc., right? Prevention recommendations, smoking cessation, etc. Proper hydration. So we don't use any modalities to speak of. It's strictly hands-on. We really stress the importance of appropriate differential diagnosis prior to treatment to make sure we have a diagnosis that is going to render the patient a positive outcome with our intervention. Because with this population, there are many comorbidities, and we don't want to miss a diagnosis of stroke or heart attack or cancer or some other disease process that needs to be referred to a different provider. So differential diagnosis is significantly stressed, and it's an important reason for having the board certification program in place with the resident training program. So even though they have had 3 years of training under supervision of board-certified chiropractic specialists and faculty members, realize they're also with medical specialists, because all of us work within what we call a pod, which is an area within a primary care facility where we have a team with the medical director, the MDs, the DOs, the APRNs, the PAs, the mental health specialists, the nurses, the medical technicians, the chiropractors, the podiatrists, the dental hygienists, the dentists, OBGYN in some clinics, and pediatricians. So it's a team effort, and everybody has a certain part of the effort as their area of expertise. So we are the neuromusculoskeletal specialists, and anything to do with pain, whether it's acute or chronic, that's caused by neuromusculoskeletal problems, that's our area of expertise, and that's what we focus our care on.
Great. And have you found that that you're ever stepping on osteopaths' toes? I know that in terms of manual medicine, a lot of times people say that chiropractic and osteopaths do similar things. Have you had any experience like that?
Well, not really, but let me go back, way back into the 90s when I was at Lovelace Medical Center in Albuquerque, New Mexico. Quite a few of our primary care physicians were internists and DOs. And I had a great relationship with many of them, and they were, right at the top of the referral chain for chiropractic services. And the situation is this: as a primary care physician, they don't have time for manual medicine. They don't have time. So, they used to tell me, boy, I wish I could do more hands-on manipulation and this and that, but I don't have the time. Plus, they're in a primary care setting, so they don't really have a table that they can use to do full spine adjustments and things like that. So I think most of the DOs in primary care don't have the time or the facilities to actually do adjusting of the spine. So at our current situation, I've never had that problem. And my current medical director is a DO. So he's been very, very supportive, as has the entire medical staff. But no, I haven't found that. But with relative to your question, it is important for a chiropractor that wants to integrate into a federally qualified health center to understand that they are part of the team. They're not the whole team. They're not the leader of the team. They're part of the team. And you need to really concentrate on what you do the best, which no one else can do there. So, yeah, there are certain things that I would normally do in a private practice that I have to refer to another part of the team. For instance, if I find a patient has a anatomical short leg and they need a heel lift, I go through my examination process. I determine what size heel lift they need in their shoe. I then write the prescription for a podiatric evaluation. They then evaluate the patient and prescribe the heel lift, which is probably one of the easiest opportunities for our podiatrist, right? But yeah, that's how the team works. And,
nice.
So that's one example.
Yeah, and it really sounds like, I mean, you did this at Lovelace. Now you're doing this in Connecticut and New Jersey. Do you? And you kind of mentioned this briefly, like this kind of narrow focus of just having chiropractors focus on the neuromusculoskeletal stuff. But in your opinion or in your vision, do you feel like this is kind of the future of chiropractic? This more multidisciplinary, where the reimbursement is still good or better than private practice, especially with the loan forgiveness. What is kind of your vision of chiropractic's place in medicine, so to speak?
Yeah. So in my opinion, the future of the chiropractic profession really is the integration into the different healthcare systems. Whether it's a federally qualified health center, whether it's a primary care practice out in a rural part of a state where it's private practice, but it's the only facility around for 100 miles, which wasn't too unusual in New Mexico. But I really believe, for a number of reasons, that the future of the chiropractic profession, and especially the graduates that are coming out of school now, is really going to be advantageous for them if they're integrated into a facility such as this. For example, when you open a private practice, you have a few different functions. You have to function as a business owner. You have to function as a clinician. You have all the different stressors related with owning a business and being a business person. And then you have all the stressors of being a clinician and taking care of your patients. When you get integrated into a system like this, you no longer have to worry about the business aspect. So what does that mean? Well, you don't have to worry about whether you're going to have any new patients to treat, because basically what you're going to have to worry about is, how can I get all these patients taken care of in an effective and efficient manner? Because the facility already has the patients. And how do you get the patients? You go to an in-service and you explain your services, you're part of the team, and they start scheduling patients. So that's a big difficulty for people starting a new business, is that attraction of new patients, right? It's never a problem in an FQHC. It's always a problem of, how can I get all these patients in? There's usually a waiting list of 100 or 200 patients when you first start. So that's a good thing, right? Plus, there's the security. You have a paycheck every month. When you leave that facility, you're done for the day. The rest of the time is yours. And I find a lot of young people prefer that. But if someone wants to run a business and they're really interested in building the huge clinic or something like that, then this isn't for them. This particular opportunity with integration is really for the people that are mainly patient-centric. They're happy with a salary, and they're interested in getting board certified and being a specialist.
Yeah. So as a student, you've kind of laid out these steps, but I just want to make it explicit in terms of the clarity of, let's say this is exactly what I want to do. I want to offer patient-centered care. I want to work in a multidisciplinary environment. I want to be a part of a pod, and I really want to focus all of my energy on my clinical skills, as opposed to also building my business acumen and entrepreneur skills and all of that other stuff. What are the steps for doing that? Is University of Bridgeport the best option? Are there other ways to integrate or to get a job at multidisciplinary clinics?
At this point in time, I think the University of Bridgeport is the #1 university and chiropractic college to offer this type of opportunity. And our partner, Community Health Center, Inc. out of Middletown, that's the organization we started with, has already expanded into 31 other states. So we expect to have our services available in 31 different states, along with resident training. Now, with that said, you asked earlier, can the other chiropractic colleges do this? And yes, absolutely they can. They absolutely can, but they have to make a decision that they want to invest the time and money to put it together. So I've actually talked with a couple of different chiropractic colleges about how they can do this. And there are, I think Logan and Northwestern are involved. And I think Western States are involved with a few different organizations. I don't think anyone's really put it all together in the way we have, with a partner that is a federally qualified health center. I believe that is really, really valuable and a benefit that helps us to expand into the other states. So yeah. What we've been doing so far is offering the resident training programs only to our graduates. But now that we're expanding into other states, we're in New Jersey as of this point. We just started this month in New Jersey. We are looking at Illinois next, and California. So I'm in discussion right now with a couple of different organizations in California. And hopefully within 1.5 to 2 years, we'll have everything up and going with chiropractic services, education, including the resident training and research.
Well, great. So, just being slightly selfish here, of course, I'm at Life West. I'm in California. This sounds like a great opportunity for me. What would your recommendations be in terms of my schooling while I'm at Life West, any kind of extracurricular schooling to ensure that I have the clinical skills necessary to be a valuable asset to, to those community health organizations if you do expand to California in the next year and a half?
Well, that's a good question. I would say that you really need to have an interest in your differential diagnosis classes, neurology and orthopedic evaluations, very important. If you enjoy doing physical examination and making differential diagnosis, I'd say you're in the right direction. But one of the things that we do offer, our particular situation right now in Bridgeport, is we allow the students to take up to 75 hours of our seminar presentation on campus at no charge. So the orthopedic program requires 300 hours. So they already have 75 hours done by the time they graduate if they're interested in pursuing this venture. Now the residents, we cover the entire cost of the 300 hours for them. In addition to that, we strongly recommend to our residents that they also get certified in acupuncture. And we have a program, 105-hour acupuncture program also. So they do a 300-hour program in neuromusculoskeletal medicine. They become board certified in chiropractic orthopedics through the Academy of Chiropractic Orthopedists. And then they become certified in the state of Connecticut for acupuncture. The acupuncture situation can vary from state to state. So I don't know exactly how it works in California, to be honest with you. That's something I'm going to have to learn. I just read this week that Ohio is now expanding so that chiropractors can provide acupuncture within Medicaid facilities. So why is that important? Well, there is an epidemic. There's two epidemics in this country that we should be very concerned about. One is chronic pain. The other is opioid addictions, and they kind of go hand in hand. We aren't the solution, but we're part of the solution. And the Joint Commission has called, since January of 2016, has called for the use of non-pharmacological treatments, including chiropractic and acupuncture, to address the chronic pain issue and the opioid addiction issue. So as future chiropractors, I would strongly recommend that you start becoming more knowledgeable about chronic pain and what's going on in this country as far as evaluation and management of these patients and how we could help eliminate exposure to the opioids. The opiate addictions come from prescription drugs from the primary care doctors and different specialists, including dentists, and with an acute back problem, as an example, acute low back problem. If the chiropractor is part of the team as the neuromusculoskeletal specialist, the primary care providers are going to refer the patients to you first and avoid the prescription of opioids. That's how I see us as being extremely valuable in the prevention of opioid addictions and providing appropriate care for the patient while it's an acute pain condition, and avoid the chronic when possible.
Yeah, I'm in complete agreement, and that's exactly why I wanted to have you on the show, because I think chiropractic's role in supporting physicians and then also supporting patients to reduce or completely eliminate their opioid use, and in order to help with chronic pain, I think is like you said, maybe the most important contribution we can make as healthcare professionals right now in this country, because it's so pervasive. So I know that there's going to be a lot of students who are going to want to learn more, who are going to want to hone their orthos and their neuros and kind of hone their orthopedics and everything. And so, how do people learn more? What's the best way to learn more about the program that you have there and kind of suss out whether that's the best fit for them?
Well, they could go to our website to get more information, bridgeport.edu /NMSM. N like in Nancy, M like in Mary, S like in Sam, M, NSMM. So they could go there and learn some more. They would see the PowerPoint presentations that we offer for the seminars. They can see an example of our online program. I believe we have the best online program in postgraduate chiropractic. It's really, really well done. So of the 300 hours, 250 hours are online, which is a real opportunity savings. So people don't have to travel. They can do it at home at their leisure. I think that there's a free book that students should take advantage of, Relieving Pain in America. Relieving Pain in America. They can go online, it'll pop right up. They can read it free electronically. If they don't like to read electronic books, they can buy it. I think it's $53 if you pay for it. It's by the Institute of Medicine. It's an excellent book that talks about our chronic pain problem in this country. So that would be a good read. And then if students, let's say in California like yourself, if you wanted to see a little bit more about what the class is like, you could actually enroll in part of the online and maybe purchase 5 hours or something like that and see what it's like. That'll give you a good taste. But there's a free sample also available on our website if you want to take a look at it and see the quality of the education. Let's see what else. I'm hoping that we will offer programs through state associations for the 50 hours. We're talking right now with the California Chiropractic Association about them offering a program, and I hope that they would make it available to students at a reduced rate of some sort. But basically what we've offered to different state associations, we put the syllabus together, etc. We have all the speakers. We have sponsors for every speaker. So a state association can teach the 50 hours and they keep all the money. So it's a good fundraiser for the state association. And then what we hope is that after a doctor takes the 50-hour program, they would go on with the 250 hours of online and become board certified. Now, I haven't given much thought to this, Noah, but possibly something could be worked out if there was a group of students. Let's say there's 50 students that would like to take advantage of that particular situation, probably for a lot less expense. A program could be put together either with your school or a different school or UB or whomever's interested, right? Yeah. Because you can take 50 hours while you're a student and it goes towards your 300 hours. You can take up to 75 hours. That's what the academy permits. 75 hours of orthopedic training as a student, not more than that.
Great. Yeah, those are all great options, and thank you for extending that opportunity or that possibility. I know I will definitely be active on my campus and see if I can get enough interest for that. Because I also agree with you that I think orthopedics are really important, especially for chiropractors, and our ability to differentially diagnose and do the physical exam. Like you said, the DOs don't have the time for it anymore. And, nobody is really doing that. And it's a really unique niche, and it's very necessary because we can get so much great information through that. So I'm really grateful for everything that you're doing. We only skim the surface of all the amazing things that you're contributing to the chiropractic profession. So really, really grateful for all of the heart and energy that you're putting into chiropractic right now. Yeah.
Can I suggest one other reading?
Please do.
There's a white paper funded by the Mayday Fund. It's called A Call to Revolutionize the Treatment of Pain in America. If you do a Google search, it'll pop right up. It'd be a good read. And it really stresses what you just said. They talk about the problem, pain, chronic pain especially, and why is it happening? It's happening because the medical school training does not prepare the physician to evaluate and manage painful conditions. So it really depicts the reason why the chiropractic profession should focus on this opportunity to integrate into federally qualified health centers and become the neuromusculoskeletal pain specialist, one that's not pharmaceutical, a non-pharmacological treatment. Now, please don't misunderstand. If a chiropractor wants to expand their scope and they want to go into other training, I'm not opposed to whatever they want to do. But what I'm saying is that the Joint Commission, a very important credentialing body in this country for healthcare, has stated as of January of last year that we need chiropractic care for pain treatment in the healthcare system. We should listen to that.
Yeah, completely. And what a great endorsement of chiropractic to have such a prestigious organization recognizing our place in pain management and promoting that and helping us to to solve a lot of the chronic, or to be a part of the resolution of a lot of the chronic pain problems that people are experiencing.
So you have a very wonderful future ahead of you, as do your fellow colleagues.
Yeah, I completely agree. So thank you once again. This has been a production of DC to Be Revolution, helping chiropractic students think big in order to live large. Please subscribe to the channel, like this video, leave some comments in the comment section below. Let's get the conversation going. Where, do you agree with what Dr. Lehman has to say? Are you opposed? We want to hear your voice. So thank you, Dr. Lehman, once again for being here and contributing to this channel and to chiropractic.
My pleasure, Noah, and best of luck for your future endeavors.
Thank you. Really appreciate it.